So the RAISE and RAISE-XT trials were respectively a randomized controlled trial for RAISE lasting 12 weeks, and RAISE-XT is an open label extension that's ongoing. And the study looked at Zilucoplan, or is looking at Zilucoplan, which is a peptide that binds the C5a complement and prevents generation of the terminal complement cascade. Patients self-administer this. It's injectable under the skin subcutaneously once a day. And in the RAISE randomized controlled trial, which is a phase 3 trial, they received either the drug or placebo. And then at the end of 12 weeks, which is the end of the study, they were offered an opportunity to go into the open label extension, which is called RAISE-XT. And most of them did, and that study is still ongoing. And so the data was collected for both RAISE at week 12 and for RAISE-XT at week 48 of that trial, or a total of 60 weeks for the whole study thus far. And so the primary outcome measure was change in the Myasthenia Gravis Activity of Daily Living Scale score. And then secondary outcome measures that were looked at: the quantitative Myasthenia Gravis scale, the Myasthenia Gravis composite scale, and an overall quality of life measure, the MG quality of life 15R. And those metrics showed significant, in both statistically and clinically meaningful improvements, especially the primary outcome measure, MG-ADL, by week 12. And then patients who were on placebo and got the drug, and they quickly caught up to the patients who got Zilucoplan and then stayed on Zilucoplan in the RAISE-XT trial. And those effects have been sustained for all of those outcome measures through the entirety of the RAISE-XT trial thus far. So that would be 48 weeks of the open label extension. But another important secondary outcome measure that was assessed was fatigue. And fatigue is a hugely important symptom to most MG patients. Most of them have some degree of fatigue. It's hard to measure fatigue. They're mostly measured by looking at the NeuroQOL short form fatigue scale, which has also been looked at for other MG treatment trials recently. But the problem with that scale is that raw data can't be converted into either severity or what's a clinically meaningful threshold for either improvement or worsening. But there is a way to convert that raw data into a metric called a T-score. And that has been looked at for multiple sclerosis related fatigue. And there are a couple of papers that have worked out the methodology. And the thought is that it's disease agnostic. That means it shouldn't be just applicable to MS related fatigue, that it could be applicable to any disease in which fatigue is an important measure or important component. And so the study looked at T-scores. They converted T-scores, the raw scores, to T-scores, and they came up with a clinically meaningful decrease in the NeuroQOL fatigue scale, which was a drop in at least 3.5 points, and that was for improvement, and meaningful worsening was an increase of 3.2 points, which is what the MS methodology has shown to be the thresholds. And then patients could also have their fatigue translated into degrees of severity. And at baseline, most of the patients had moderate to severe fatigue, and only 2 patients had no fatigue in the entire at the beginning of the study. And so the same RAISE and RAISE-XT results, those studies showed that, again, there were important improvements in fatigue that met that clinically meaningful threshold for improvement. So there was a relative decrease in the T-scores for the NeuroQOL at week 12 of the RAISE that was minus 3.61 points, so it met that threshold. It was more than the minus 3.5 threshold. And then patients who then transitioned into RAISE-XT, who were on placebo, within a week, most of them had reached the same level of reduction of fatigue as the patients who were on Zilucoplan and then transitioned into Zilucoplan in RAISE-XT. So that goes along with our idea about how this drug affects complement. Complement is C5a is inhibited almost entirely within a week, and so that correlates very well with that. And at week 60 of the entire study, or week 48 of RAISE-XT, patients who previously had very severe or moderate disease said many of them no longer had that. In fact, the vast majority only had mild or no fatigue at week 60. And so 2 patients had started with no fatigue at baseline. By the end of the RAISE-XT interim analysis, 14 patients had no fatigue. So we think that is very meaningful improvement, not only in terms of what's statistically significant, but what patients want, how they want to feel. Because if we were to say that it just reduces fatigue without assessing severity, I think that would be hard. It'd be hard for patients to know how effective this drug is. But with using this methodology, it suggests that the effects on fatigue are profound. And whether that's going to be true for patients in the real world, we will soon see. But we're hopeful or optimistic that this drug will have a marked impact on fatigue and MG. And we're looking forward to hearing from patients that they're doing better with their fatigue as a result.